happy to welcome Dr. Chris Fox as our speaker today. Dr. Fox is the director of the Policy Evaluation and Research Unit at Manchester Metropolitan University. And we've been fortunate to work with him for a few years on a collaborative research project on comparative research on social impact investments. And so in 2018, Dr. Fox, a number of colleagues, and Dr. Painter, Gary Painter, director of the Price Center, wrote a book on social impact bonds. And then just this past summer, we collaborated to publish a briefing series on the future of social impact bonds. So all of that work is on our website. I encourage everyone to take a look if you haven't yet explored it. So that's some of the themes that Dr. Fox will talk about today. I think you'll give a presentation and, of course, as always, open it up for questions. So with that, please join me in welcoming Dr. Fox.
Great. Thanks very much. Brilliant. And it's lovely to actually be here in person on campus for the first time in a long time, so thanks very much. I'm going to talk today about some of the work that we've been doing on social impact bonds, or SIBs as they tend to get shortened to. And I'll start off by just explaining what a social impact bond is for those of you who aren't familiar with them. They're an innovation in financing public services that have been around for a while now, a good 10 years, but they're still quite niche. But growing, as we'll talk about in a minute. And then I'm going to talk in particular about some research that we've been doing in the UK on a group of SIBs that we think are quite innovative in that they represent a bit of a step change in the way that SIBs are being run and designed. And I'm drawing on some work that I've been involved in, but I'm also talking on behalf of a group of people. So this was a combined piece of research between my research unit back in the UK, the Policy Evaluation Research Unit, and the Social Innovation Centre here, and in particular Hilary Olson, who's a PhD student here, was involved in some of the field work, and Gary Painter, who can't be here today, has been involved in some of the sort of setting of this research as well. So, without further ado, I will dive into the presentation. So, for those of you who aren't familiar with social impact bonds, I should probably start by explaining what they are. There's been a move over a number of years, particularly in the UK, but in other jurisdictions as well, including the US, towards the idea of outcomes-based contracting and payment for success, pay for success contracts. One of the challenges with pay for success contracts is that clearly the organisation that's delivering the service and is only going to get paid for an outcome has to then raise capital to deliver that service up front before they then get paid later on if they deliver outcomes. And obviously for a lot of smaller voluntary sector organisations, that's a hard task, or sometimes an impossible task, because their terms of constitution don't allow them to raise money or to take those kind of risks. Social impact bonds developed initially in the UK as a way around that kind of problem. What happens in a social impact bond is that investors, normally philanthropists, will fund a programme of work up front. That's then delivered by a local organisation on the ground, often a not-for-profit. And if the outcomes are delivered successfully, then a payer, normally central or local government, depending on the jurisdiction and the country we're talking about, will then pay for the outcomes that are delivered. So that's the basic model. It's called a social impact bond, but it isn't a bond. It's not a bond in the usual sort of sense of a bond. It's essentially recognising that government is a safe payer, that government wants to achieve certain outcomes, but only really wants to pay for the outcomes it achieves, not simply for outputs. And by basically starting to move to this kind of model, local delivery agencies are freed up from burdensome contracts that focus on outputs and instead can focus on the outcome they're trying to deliver, which hopefully encourages them to innovate and to think creatively about how to deliver that outcome. Investors, funders, normally philanthropic organisations, can find a way to invest in social projects, social purposes that they're interested in, and have the potential to get their money back if the outcomes that part of the contract are delivered, which then allows them to reinvest that income in the future. And for government, there's essentially a risk transfer going on here. Government's only paying for outcomes that are delivered rather than simply paying for a service to deliver throughputs. So that's the basic idea. It's a payment by results model. So certainly in the UK, payment by results has been quite a a kind of controversial idea. I think a lot of people like the idea that government would pay for outcomes rather than outputs. Surely what we want to do is to pay for social goods that are achieved. We want to pay for people to be found jobs, or people coming out of prison to be rehabilitated, or people with long-term health conditions to have those conditions stabilised. We want to pay for those outcomes rather than simply paying for activity which may or may not deliver outcomes. So there's a kind of an attraction in that. But equally alongside that, we've got this quite complex arrangement with additional parties involved in the delivery of services. And we've also, certainly in the UK, got the suspicion that this might be a mechanism for bringing in new types of providers and undermining traditional public service provision. And there's a whole debate, particularly in the UK and Europe, around SIBS, which kind of focuses on that kind of idea. But I think in the US that's been less of an issue. So these are not without controversy. Just to give you an idea, and unfortunately I was banking on Gary being here to talk about this slide a little bit, because this is from the US end of our research. But this is just to give you an idea of a social impact bond a bit closer to home. The ones I'm going to talk about mostly are UK ones, but this one's a bit closer to home. So this was the Santa Clara County project, which has all the sort of main elements of a social impact bond. So we've got the idea of a group of people who are homeless and the outcome of trying to help those people move into accommodation with stable tenancies and improve health and well-being alongside that. We've got a service provider, we've got a back-end payer, Santa Clara County, and then we've got a group of investors who are going to find the upfront capital to make the whole project work. And so that just gives you an idea of a sort of practical social impact bond. But yeah, please don't ask me detailed questions about this one, because I will struggle. So progress today, where have we got to with SIBS? Well, as I say, the first social impact bond was developed in around 2010 in the UK, and that was a prison-based social impact bond, and it was set up in a Peterborough prison in the east of England. And the SIB was about resettling people coming out of custody. So it worked with 2,000 people coming out of custody, and the outcome was all about improving the chances of them being successfully rehabilitated. Since then, there have been around 200 or so SIBs that have been set up around the world. The bulk of them are still in the UK. I think around 100 are in the UK. There are currently around 27 in the US. And then a smattering in other parts of the world. Various European countries, particularly Northern European countries, have tried this model. There are a few that are being set up in different parts of Asia, Southeast Asia. There are some starting in Japan, Hong Kong. There are certainly some projects in China that possibly have elements of a social investment SIB model about them, but probably aren't SIBs quite in the way that we're talking about here. And there are also what are called some development impact bonds, which is where this kind of model is used to fund overseas development. The UK government has funded a number of development impact bonds, and essentially it's a mechanism, similar kind of mechanism, but rather than the payer being a local government, the payer in the case of the UK has been the UK government paying for development projects, mostly in sub-Saharan Africa. There have been one or two DIBs funded by US philanthropic organisations as well, again, I think primarily in sub-Saharan Africa. Programmes around sort of clean water, education for girls, those kind of things. So again, it's a model that's been being tested in some different settings. By the way, this is one of the briefings that we pulled together that Megan mentioned, and they're all on the website. This one was by Emily Gustafson-Wright at the Brookings Institute, who's done a lot of work looking at SIBs worldwide and putting together sort of an overview. These are predominantly programs that would self-identify as SIBs, although there is a grey area. There are various social investment models that are pretty similar to SIBs or have some characteristics of a SIB. There is not a really tightly defined definition of a SIB, and it's not a regulatory set of regulatory requirements, so there isn't a really sort of fixed model. Certainly in the UK, there's a bit of a move to distance from the SIB label, partly because of the controversy around whether this is maybe undermining existing public services, and so there's almost been a move away from that model. So people are starting just to talk about social outcome contracts rather than SIBs. So it's not an absolutely tight definition. So the work I'm going to talk about, though, particularly today, is looking at 4 SIBs in the UK. And we looked at these 4 SIBs because the early SIBs that were developed tended to have one primary outcome, so reducing reoffending, reducing homelessness, improving health, whatever it might be, essentially one primary outcome. And they tended to be relatively fixed in the way that they work. So there would be an intervention that was developed to tackle an outcome, and the SIB was all focused on the delivery of that intervention to deliver that outcome. Sometimes those interventions would be reasonably innovative, but actually certainly our early work on SIBs suggested that SIBs were producing less innovation in service delivery than we had originally thought they might. And that was because the financial risks around the SIB tended to mean that people were quite conservative about the kinds of interventions they use. They tended to want to use interventions that had some kind of evidence base, some kind of proof of concept behind them before they tried them, because obviously if they tried something really innovative and it didn't work, potentially therefore they were going to lose quite a lot of money, or investors were going to lose quite a lot of money. So they were generally not necessarily producing quite as much innovation as we had expected, and a number of research projects, including some of our early work, sort of confirmed that. But we were interested in these SIBs because these seem to be a new generation of SIBs. And we looked at 4 in particular. They're all SIBs in the UK. They're all managed by Bridges Outcomes Partnerships, which is a social enterprise in the UK that has been one of the larger funders and managers of SIBs in the UK. So I won't give you all of the detail here. You can probably read this faster than I can talk through it anyway. But basically, these 2 SIBs that I've got on the screen now, Be the Change in Northamptonshire was working with young people either at risk of homelessness or already homeless. And the Greater Manchester Homes Partnership was looking at people who were adults, not normally older adults, 35 plus, who were entrenched rough sleepers. These SIBs are pretty typical of the UK in the sort of numbers. You know, that SIBs typically in the UK have worked with a few hundred up to a couple of thousand people. There are a few SIBs that have worked with larger numbers in either the US, and there's a couple in Finland, interestingly, that have worked with quite large numbers. But generally, working with 1,000 or so people over 2 or 3 years is pretty typical. And these ones all had outcomes around sustaining accommodation or getting people back into accommodation, that kind of thing. The other 2, again, another homelessness SIB, Kirklees, sort of north of Manchester in the UK. Again, focusing on homelessness, but quite a broad definition there, not people who are street homeless necessarily, but people at risk of different types of homelessness, and a slightly larger group, as you can see, around 6,000 in this SIB. And then finally, we also looked at a SIB in northeast Lincolnshire, which is the kind of east coast, quite a poor area in England, sort of northeast England on the coast. This was actually in a town called Grimsby, which used to be a big fishing port and has now sort of gone into quite substantial decline. And this was basically a SIB focusing on long-term conditions, so people typically with long-term conditions like diabetes, and trying to work with people to improve or stabilise their long-term conditions. So those were the 4 SIBs we were looking at, and what made them interesting for us and why we thought they were worth a closer look was that they had 2 important innovations within them. One was that rather than simply focusing on a single outcome or maybe 2 outcomes, these SIBs all involved what's called a rate card, which is where there are a whole series of potential outcomes that people can aim towards. So rather than simply paying for a cohort, so the first SIB in Peterborough, the prison one, the payment was based on the overall rate of reoffending for cohorts of 1,000 people at a time. So if the cohort of 1,000 people coming out of the prison, if their offending was reduced by approximately 10% on a comparator, then there would be a payout. These SIBs are about individuals, so the rate card relates to individuals. So there are a whole series of outcomes that individuals can aim towards, and that the services can work with individuals to deliver, and each outcome has a value attached to it. So for one individual, if you get them into accommodation, there's a £600 payout. If you sustain that accommodation for 3 months, there's a £1,500 payout. If you sustain it for 6 months, there's another £1,500 payout, and so on. So there's a whole bunch of outcomes there. So that's one innovation. The other innovation is that these SIBs were not really focused on a single intervention. What they were doing instead was encouraging frontline practitioners and local partner agencies to innovate a whole series of potential innovations and services that might address issues for particular people that they were working with. Some of these this is not the entire list of innovations, this is to give you a sort of an example, but they had things like the recruitment of asset coaches. So these were people who were going to work with service users in a strengths-based way, and I'll talk a bit more about what a strengths-based model looks like in a minute. They had a diversion from custody program, so that street homeless people who were at risk of going back into custody because they had maybe breached a licence condition and were going to end up back in prison, could be diverted out of custody if it could be demonstrated that they were engaging with services that the SIB was running. They had a personalisation fund, which was essentially an ability to purchase goods and services for people outside of normal sort of statutory requirements, so outside of traditional benefits payment systems or kind of welfare funds. This personalisation fund was a sort of an unhypothecated discretionary fund. So if someone was working with someone who was street homeless and they identified a need that person had that couldn't be met from traditional sources, they could, for instance, buy white goods to put in a flat to make the flat functional, or they could buy someone a laptop so that they could join a college course and be able to participate because they had a laptop like all the other students, that kind of thing. So these very, very kind of discretionary but relatively small amounts of money being spent to kind of meet people's immediate needs. They had a digital ID experiment, which was where they basically created cloud-based storage for people who are street homeless to keep key identity documentation in a digital form, and an app that they could then download it very easily to a phone, because obviously a classic problem for people who are street homeless is they can't access services because they don't have identification. So they had lots of experiments going on, and the idea was that frontline staff were being encouraged to innovate, try new things, test them with different groups of people, gather data, understand what was working, and then quite quickly and rapidly move on. So this is quite a departure for SIBs because, and for a lot of services, to be honest, because it's encouraging quite a sort of fast-moving, innovative way of thinking about service delivery. So when we looked at all these SIBs, what we found was that all of these SIBs were underpinning all of these SIBs was the idea of a strengths-based way of working with people, and I'll sort of say a bit more about that in a minute. So strengths-based working is essentially the idea that you have to sort of see people not in terms of problems, deficits and the kind of challenges they face, but you have to work with people in terms of their potential, their assets, and help them build their capacity and their capability. And if you work with people in that way, they will respond differently, whereas traditionally public services tend to be based on the idea that the people they're working with have a problem and their job is to fix the problem. This strengths-based working is not about fixing the problem directly, it's about helping the person fix the problem. So these were all using strengths-based models of delivery, which is a very personalised way of working. It means very personalised, individualised ways of engaging with service users, not a sort of one-size-fits-all model. And that then had a whole bunch of knock-on effects for the way that these SIBs were delivered. So it meant that they were changing the way that the organisations, the local charities, not-for-profits that were delivering the services, they were changing quite fundamentally the way those organisations were structured. They were changing the kind of approaches to planning and working with individuals. They were changing the way in which the whole local system was working, because once you start to put this kind of model into a local system, it starts to influence all the other services in that system, and they start to, in some cases, respond and work differently as well. And then finally, what that overall led to was kind of a move towards a much more personalised and co-produced way of working with people. So those were our kind of headlines. So I'll just quickly run through what those meant in a bit more detail. So strengths-based working is an interesting one, and I know that one of the challenges, and Hilary and I were talking about this yesterday, is that it's one of those terms that probably means different things to different people, and there are different sort of ways of understanding it. But what we've generally understood by sort of strengths-based working, certainly in the UK, is that traditional public services, which were often set up many decades ago to tackle problems that have probably changed a lot since they were set up, tend to work in what we would see as a deficit-based way. So, when I think about sort of health services are quite good at, patching people up if they have an injury and putting them back into the community, but maybe they're not so good at dealing with people's long-term health conditions or their long-term mental health problems. Education services are good at, delivering exam results maybe, but maybe they're not so good at building people's resilience and capability to be able to change careers continuously as they sort of operate in the world we now live in. So there's a risk that a lot of services out there are kind of deficit-based, and what they're essentially doing is they're seeing the people that come towards them as having a problem to be fixed, and they're trying to fix the problem. And of course, the problem with that approach is that doesn't really build people's capability. So strengths-based approaches, on the other hand, are all about building people's capabilities, helping them build their capabilities, giving people a sense of agency, giving people a sense of control over their lives, helping people to make effective links with both organisations that can help them, but also individuals in their community who can help them, building up their intangible resources so that they are in the long term more resilient, better able to help themselves. A good sort of example of this is Hilary Cottam's book called Radical Help, where she kind of documents a bunch of projects she did, which was very much using this kind of approach, this kind of ethos, so that's a good read, I'd recommend that. And as she says, the current welfare state has become an elaborate attempt to manage our needs. In contrast, what we actually need is help that will support us to grow our capabilities. So at a more theoretical level, we can link these kind of models into the work of people like Sen and Nussbaum talking about capabilities and capabilities theory. So that was one of the big changes that these SIBs were able to achieve by sort of working in this very different way, by essentially having a rate card that allowed them to work with people on different outcomes, being able to innovate around different ways of working. All of that sort of helped create this kind of ethos. It then led to a whole range of changes in the actual organisations. The most radical organisational change I think we saw was in the Northamptonshire SIB, where a charity called Mayday was delivering the service. Not specifically because of that one SIB, but because of a range of work Mayday was doing. It went through some quite radical changes in the way that it operated. It went from being a traditional housing provider to being a much more flexible and innovative organisation. It actually got rid of its stock of housing and focused instead on this idea of capability building and building people's sense of agency. Went through quite a radical change, and that in turn led to quite radical changes in the way that its staff worked. Because if you're going to work in a strengths-based, innovative way, you've got to have a different kind of person potentially delivering the frontline service. So it's all about building relational skills, using techniques like motivational interviewing and appreciative inquiry, a lot more responsibility being devolved to frontline staff, allowing them the room to innovate, the time to reflect on their practice, to think about what works and what doesn't. New roles were being created that were involving people with lived experience. So some of the services being delivered by people who had themselves been homeless, who'd experienced homelessness. Obviously, they were able to then develop a different kind of rapport and empathy with people. They had a different understanding of the issues people were facing. That then led to different approaches to kind of recruiting staff. So big emphasis on values-based recruitment, recruiting people who share a set of values rather than necessarily focusing on the skills that they bring. And then, of course, that led to different types of training, etc. as well. So there was quite a radical change in the actual frontline service delivery organisations as a result of this model of working. That in turn was leading to, as I sort of said, different kinds of organisations essentially. So some of these organisations were starting to reinvent themselves. They were getting rid of more traditional hierarchical models of organisation. They were moving towards flatter organisations with more porous boundaries. They were starting to kind of see what they did as very much delivered within a system rather than within an organisation. So they were working across systems. They were much less conscious of themselves as an organisational entity, much more thinking about themselves as part of a system. And in that process, they were then able to test lots of interventions because they were able to collaborate innovatively with lots of different organisations. So a lot of those innovations that I put up on a slide earlier on couldn't have been done without close collaboration. The digital ID example, for instance, only works if other agencies are prepared to recognise that ID. You can't do that in isolation. It has to be done at a system level with partnership working. So we were seeing a sense of some of that change going on. And interestingly, we were also seeing and we're still exploring this more, but seeing possibly a particular type of organisational leader emerging, focusing on people who were very energetic, who had authenticity as leaders and were able to work within these systems, drawing on a range of experience and navigating between these organisations in quite interesting ways. And then sort of coming towards the end, we sort of had some ideas around rethinking planning and risk. So again, these organisations were working with people in different ways. They were, by using a strengths-based approach, they were focusing much more on building relationships and trust with people, and that led to different assessments of the risks that people posed. And as risk was re-evaluated, that then opened up possibilities for different ways of working with people, planning with people, developing service plans with individual clients changed in terms of the way it was done and the kind of aspirations that behind those plans. And underpinning quite a lot of that, we saw a really sort of strong move towards more co-produced ways of working. We made a distinction between co-production and co-creation. Co-production, where individual service users work with a frontline member of staff to co-produce their service, make it a much more personalised, individualised service. We saw quite a lot of examples of that happening. And then increasingly what we're now seeing as we sort of continue to follow a couple of these SIBs is that they're moving towards a model of co-creation where service users then get involved in the overall design of the service. So not only are they helping to co-produce their own service, but they're actually then starting to influence the design of the broader service and the broader system in some cases. So we saw interesting examples of that emerging. So some conclusions. What we think we've seen by looking at these SIBs is a kind of a distinction between the first 50, 60, 70 SIBs that were set up in the first 5 to 7 years of SIBs. Those first SIBs, a lot of the focus was on building quite complex contractual mechanisms and financial instruments to make SIBs work. But arguably, we think that possibly a little bit too much emphasis has been placed on the sort of technical side of the SIB process, the contractual complexities and the sort of opportunities to measure outcomes in different ways and create quite complex financial instruments. Clearly, they're an important part of the process, but that's not what SIBs are about. And this quote from Robert Pollock, who was previously at Social Finance and wrote one of our briefings, kind of captures that quite nicely. We've looked into the finance mechanism for the secret source of SIBs magic when we should have been investigating how they can be designed and how governance can be put in place to give people a different experience of delivering services and receiving services. And what we're seeing in SIBs 2.0, as we're calling it, is a bunch of SIBs that are starting to move away from that focus on simply financial metrics and outcome measures to create the conditions for much more innovation around the way in which services are delivered, assessed, how services change over time, all about putting people at the heart of the service, all about continuous learning and all about systems change. So it's not simply about a new way to finance a service, it's about something much bigger than that. It's about an opportunity to try out new ways of working and to change whole systems. So what we see SIBs 2.0 doing is really embodying this idea of human learning and systems, and there is a human learning systems theory that is being developed certainly in the UK. People like Toby Lowe and Rob Wilson writing quite a lot about this model of delivery. It's a model of public service delivery that, as you would imagine, puts people first, tries to focus on what people's needs are and work with people in a strengths-based way. It's about then creating the conditions for frontline workers to innovate and continuously change and improve and adapt their practice. And it's very much about recognising that public services are not delivered in isolation by single organisations, they're delivered in systems, and therefore we need to have models that are based entirely on the idea of the system. And so for us, SIBs 2.0 very much potentially embody that kind of model. And we're continuing to do further work on some of these SIBs and looking at some new ones that are coming on stream at the moment, which are going even further in terms of these kind of innovations. And what we think from all of this, hopefully, is that while SIBs to date have been quite a sort of niche enterprise, these kind of SIBs we think have a bit more potential to be applied more widely and maybe to generate greater levels of innovation and change, which potentially makes them a more interesting way of delivering services and worthy of further investment and ultimately research from researchers like us as well.